The traumatic brain injury cases for people that had very high IQs before has always posed a bit of a problem. The problem in this is that generally, because the imaging hasn't been great for mild traumatic brain injuries, and because most brain injury cases are traumatic brain injury cases, those people who with high IQs or with professional degrees that are very reliant upon their intellectual abilities have had the problem of going and being reliant upon neuropsychological testing that will then show that they are normal in the testing even after they are damaged. But the problem is not, are they normal or not? The question really is, are they the same as they were before? What very few people understand is that there are tests, neuropsychological tests, that can be done after an injury that can report upon what your pre-accident capacity was, or the doctors will refer to it as premorbid abilities. And we can map out effectively where you were in terms of IQ and your cognitive function before an injury, even though the testing is done afterwards. We then compare that to where you are afterwards. And as an example, even if you were, say, at the 95th percentile of the population before an accident, say you were a doctor, you relied heavily upon your IQ and your intellectual function, but now you're at the 50th percentile, or you're exactly average for the population, you would still be considered normal on the neuropsychological testing, but you've lost so much IQ that you essentially have decreased in the population IQ base by 45 points. That is a huge issue, and if you think about peak performance in any type of practice in the world, you look at a Michael Jordan, you look at a Michael Phelps, you look at any athlete, or you look at any intellectual inventor or anybody that is using their cognitive abilities to treat patients or represent people, you are more reliant upon that higher IQ than people with a lower IQ. And in fact, if you look at the statistics from the US government, you will find that people with the highest degree levels and the highest IQs have the largest fall off in their ability to work after a traumatic brain injury. And so our office is focused in on representing people with traumatic brain injuries, regardless of what your pre-accident IQ is. But for people with that higher intelligence, and for people that are very reliant upon their intelligence, having us represent you can be very important, because we're able to show the difference between your pre-accident and where you are now. And even if you're still considered normal, it's not normal for you, and you may not be able to work anymore as a result of that change in function.